I know you're going to ask Nito Sinse. Nito, you stand there.
Thank you, sir. My name is Dr.Anharur. I'm from Bangladesh. I'm general laparoscopic surgeon. It's a fantastic workshop, and thanks MESDA for giving me opportunity to attend the program. My question is that, who is the champion? The patient is diabetic and is obese. He needs weight loss as well as diabetic control. So Sleep Plus is the best procedure for that. I want this question is for both of you. Can you give some points favoring Dr. Sudeep sir regarding this point? Sleep is the champion or not? And Naito sir about Sleep Plus. Can you tell me the points regarding this?
Well, actually, it depends on the patient's data. I mean, if the patient has a longer, duration of the diabetes history, and their insulin secretion ability, is decreasing. Like, the ABCD score is measuring the, islet cell function. So if the islet cell function is weak, like ABCD score is less than 5, we're going to recommend the sleep bypass procedure for the patient. But in Japan, still, they need to pay with their private expense. But it depends on the patient's will. So, is that okay for you?
Yes, okay. Can you add something regarding sleep, Sudeep sir? Do you have any points that is superior than Sleep Plus?
Yes, of course. You can see that if the ABCD score is above 6, 6 to 10, sleep is working as well as Sleep Plus. Okay, then the very interesting group, very challenging group of the patient that in our interest is about very, very severe diabetes, which the pancreatic functions already burn out. So this is very difficult. Yes, it's been shown from some study, especially from Japan, from Nito group, that it might be working added on top of sleeve gastrectomy. But if you have a look carefully, not only between 0 to 5, but probably 5, 4 or 5 might be working.
You mean the very severe round?
Absolutely.
Yeah.
Absolutely. Then at that point,
like type 1 diabetes, right?
Similarly to that. Then at that point, if you pass something, it not be working. So I would say that right now we know that we need to invest on this part. We need to do a study on this part. What is the best to add to the patient to have the patient out of the problem? But up to the evidence, I think doing a sleep is good enough for the patient on this group to accept 4 to 5.
I know, but the patient with the ABCD score 0 or 1, they're going to decrease the weight. It's end the stage of the diabetes, type 2 diabetes, and they're going to decrease the weight. So maybe you don't need the surgery, right?
Probably. We out, both of us.
Sir, that's a different question. Last question from me. That is, when I went to India for a bariatric training in Indore, there is a surgeon, Dr. Mohit Bhandari. He was a very famous bariatric. He is now practicing orally ingestible water capsule. Right now, he's practicing for minimum weight loss. In Japan or in Thailand, are you practicing this thing for weight loss?
Excuse me? What?
This is a capsule, orally ingested. And when it is ingested, it inflated automatically by water. And it reduces the appetite and hunger. So the patient gets weight loss within 3 months or 4 months. So he's practicing this new research product in India. So do you practice this in Japan or in Thailand?
Actually, no. I don't think so.
Actually, the endoscopic treatment or the ballooning or capsuling, I think it's been part of the complementary to the treatment. So I think you may use for pre-op weight loss. You may use for a very, very low BMI that is not fit to the indication that we do have. So in Thailand, we do have a guideline, and also we support our gastroenterologists to do on that part too.
Yeah,
So it's part of the combination multidisciplinary treatment.
actually, that because that in Japan, that such like a balloon or the intragastric tube or something, intrajejunal tube, is not approved by the Ministry of Health and Welfare. So we have to do that in the human research. As a human research, it's very difficult, very high barrier. So no, not the clinical practice. No.
Thank you, sir. Thank you.
And also I think you're talking about our good friend Mohit Bandari. Right now, he also doing several cases of the endoscopic gastroplasty, the sleeve gastroplasty. I think we've been waiting for the result.
Good.
Any more question? Any comment? Air Force?
Actually, important thing is that sleeve gastrectomy and the sleeve plus, we're not fighting. We're doing the same thing. Yeah. We're not denying each other. And I mean,
yeah, exactly. It's depending on what you are looking for. In terms of having the accessible to the patient, I think we need to.
We need both. We need both.
Both. And Sleep Plus, we're still waiting for more information.